Umuthi Bururi wa Kenya ni wadikithia namba nene ya arwaru a murimu wa COVID-19. Ari arwaru 796 hari ithimi 6,754 namba ya arwaru guku bururi-ini ari arwaru 15,601 na hari arwaru aya gicunji gia 3.6 ni arigitani.
Again, leading to the emphasis that we've placed that this disease is really well within our communities. Again, to place the emphasis that, any one of us could actually be afflicted with this COVID-19 disease. In terms of distribution by cases by county, Nairobi has the highest at 539 with a positivity rate of almost 13%.
Adu 378 nio mahonete murimu wa COVID-19 igana rimwe ria 99 ari amari mutaratara wa kurubuyo mari mucii igana rimwe ria 79 makirekererio kuma thibitari-ini itiganite athuri magithie na mbere na kwandikithia namba nene ya arwaru.
We have 503 males, 293 females. The youngest is 1-year-old infant while the oldest is 87. And I feel it becomes important to emphasize today, while we do have the 796 cases reported today, 89% of them are asymptomatic.
Arwaru aingĩ a mĩrimũ itiganĩte gũkũ bũrũri-inĩ ni makoretwo makĩigua guoya gũthiĩ gwetha ũrigitani magĩtigĩra kũnyitwo nĩ mũrimũ wa COVID-19. Mũtabarĩri wa mĩhang'o thĩinĩ wa Ministry ya ũgima wa mwĩrĩ Mwangangi akĩũria arĩa mabatiĩ gwetha ũrigitani kwaga gwĩtigĩra.
Every 1 year, if you're having about, say, 1 million Kenyans visiting a hospital because they're unwell, it means about 30% of them in the times of COVID, the early phase of COVID, decided not to visit a health facility or were afraid to visit a health facility or could not get to a health facility. And of course, that has ramifications when it comes to the health of the nation. We've seen a decline in immunization services, particularly DPT-3, which is an indicator for immunization. We saw about a 20% drop of that. We've seen a decline in deliveries.
Ngũĩ cia kĩmũciĩ ũnyitani wa kĩahinya ni imwe cia maũndũ marĩa mongererekete na njĩra nene kuma rĩrĩa kĩng'ũki gĩa COVID-19 gĩakinyire gũkũ bũrũri-inĩ. Thirikari ĩkiuga o mũndũ wothe nĩagĩrĩirwo gũkorwo akĩrorwo na njĩra ĩrĩa yagĩrĩire.
The country has witnessed a 7% increase in the number of all forms of violence incidents from March to June compared to a similar period last year. We have noted with concern that some counties, particularly Wajir, Turkana, Kisii, Nandi, Lamu, Homa Bay, and Kisumu, have recorded a 30% increase in cases of violence since the beginning of the pandemic. Worse still, and this really is a shocking statistic, close to 5,000 rape survivors have received medical treatment in health facilities during this period of the pandemic.
Kenya ni maikirio ritana ria kwaga gutengera mathibitari-ini riria murimu wehiriria kuona ni kurakorwo na ũritũ gukorwo makirigita mirimu iyo. Ngiribotera Kameme TV, Rachel Wanjiru wa Foro.